Hi everybody, Dr. Kambeitz Chiropractic here. Today we're going to talk about the shoulder. We see many patients with shoulder problems, and it's a problem that we see a lot of because it's a freely movable joint. So one of the first things that we do in our practice here is we do a scan to see how the body's functioning. So we do a scan to see how the muscle tension is in the body, we see which way the muscles are pulling, and then we'll see if there's heat and inflammation in there. Because the body and the master system of the body is the nervous system, the first thing we always want to look at is how are the nerves functioning and firing. So another easy way to do that is we also will look at an x-ray depending on the patient's age, and we'll see how their x-ray looks. So obviously in a situation where the discs get thin, the nerves aren't firing as well. So the very first thing that we always look at, how is the nerve firing? Because the nerve controls the joint function, mobility, controls the muscles. So that's a big thing. So when we take an x-ray, what we'll do is we'll look at that area and we'll see what's the collarbone look like, what's the joint look like, if they're a younger individual, what does the growth plate look like, and then we'll work on those areas there. What happens in the shoulder, past about 10 degrees of abduction, the shoulder blade wants to move also. So it's not just the area of pain. Sometimes professionals will just look at the area of pain. In chiropractic, we look above and below those areas, and we always start from the spine out also. So the way that we treat the shoulder area, again, is we want to make sure the nerves are functioning and firing correctly from the brachial plexus here down into the shoulder joint. So one of the things that we use in our clinic is this instrument here that taps real light but quick. So what we'll do is we'll have the patient make sure they have proper range of motion. A lot of people, when I look at their range of motion, they should be able to turn all the way over to their shoulder. Most people are about half of that. So obviously that area is not moving correctly, which means it's not functioning correctly, which means the nerves aren't firing correctly. So it's not just about the shoulder. We make sure the neck area, proper range of motion. We'll use the instrument, and what we'll do is we'll take that patient through a range of motion. So this will tap really quick. It will tap 12 times per second, and we're working through an area in a painless range of motion, and we're doing all the ranges of motion, internal, external rotation, abduction, flexion, and extension to make sure that shoulder is moving correctly. And obviously it takes a few treatments to really get it moving correctly, but we have enormous and great success with treating the shoulder area.